Hi there, I'm Dr. Hagmeyer, and while I don't know the exact reason that you're interested in doing the gluten cross-reactivity test, I do know that if your loved one is watching today's video, you're searching for answers and you're searching for a solution. And I can tell you the best way to start solving any chronic health problem and really finding an answer to those problems starts with testing. It's not possible to fix something if you don't know what's causing the problem. So in today's video, you're going to learn why testing for gluten cross-reactivity is important, why it can be a game changer for your health, and of course I'll explain who this test is recommended for, and finally I'll help you understand in simple terms really what we mean when we say gluten cross-reactivity. Now, if you're like any patient who struggles with chronic health problems, then you know that creating good, vibrant health, really overcoming sickness and overcoming disease, really starts with diet. Unfortunately, and sometimes, one man's food is another man's poison. And if you're like many of my patients, one thing that you may have already started doing is giving up certain foods like dairy and gluten. But what if that doesn't work? Or what if it's only made a slight improvement in your health? Or what if it's made no improvement at all? Should you go back to eating gluten and dairy? No, you shouldn't, and not so fast, all right? If you've tried following a gluten-free diet and a dairy-free diet, and you know that it's not the easiest thing to do, right, for more than a week, and so it's easy to become frustrated, and with that comes along people who now give up and basically say, well, that doesn't work for me. And so there's a lot more to this than meets the eye. I wish it was easy, but the fact of the matter is if you haven't experienced the results that others have experienced, you need to dig a little bit deeper into this gluten story. You see, gluten and going on a gluten-free diet is so much more than swapping out your bread for a gluten-free version, or swapping out your gluten pasta for a gluten-free version of pasta, or swapping out the breakfast cereal that's laden with gluten to the gluten-free version of that breakfast cereal. And so again, this is why an understanding of gluten cross-reactivity can really help you get to the next level and help you overcome a plateau that you may have hit, right? One thing I'll say is with the changes that you may have already made in your diet, you might be close, right? But you may not have hit the bullseye just yet, right? So that's where this test comes in. This is a test that I often recommend to people who have already, perhaps they've gone on a gluten-free diet, but they're still eating a lot of these gluten-free grains, right? They're still eating grains perhaps, and these are your non-traditional grains. These are going to be things like perhaps like oats and quinoa, maybe cassava, maybe they're eating some corn or anything else that you see listed in this illustration. So if you're eating any of these foods while you're following a gluten-free, dairy-free diet, yet you still experience symptoms of gluten exposure, maybe it's brain fog, maybe it's headaches, maybe it's digestive issues, maybe it's rashes, maybe it's weakness or chronic joint pain or swelling in different parts of your body, or maybe even thyroid problems or inflammatory bowel disorders or fatigue, I recommend the gluten cross-reactivity test and consult. Now that you know one of the biggest reasons why I will often run this test, now let me explain what is happening inside your body and why, despite following this gluten-free, dairy-free diet, you continue to struggle with unresolved symptoms. So with gluten-free reactivity, this is really where things get interesting, right? Here's what's going on in layman's terms. Your immune system makes antibodies that target bad guys, right? We call these bad guys antigens. These antigens can cause harm and problems within your body. If your body identifies and tags gluten as an antigen, remember a bad guy, your immune system will begin making antibodies and really sounding off an alarm process in your body. Unfortunately, your immune system's recognition system isn't perfect. So as long as a molecule's structure is similar enough or close enough in shape or size or amino acid sequence, your immune system is going to register it as a bad guy and it begins to attack it. And like I just mentioned, this system is not perfect, and unfortunately, those antibodies can wrongly tag or identify other proteins in the body as if they were gluten. Here's the major problem. Once the immune system is activated, not only is your body flooded with different kinds of inflammatory chemicals and cytokines, the immune system can now start attacking other organs and glands of the body thinking that these organs are also bad guys. This is how eating something or drinking something made from cow's milk can go on to cause an autoimmune disease like type 1 diabetes or rheumatoid arthritis, or how eating gluten can go on to cause things like celiac disease and other kinds of autoimmune diseases. You see, if the foods you're reacting to cause inflammation in your body, this can lead to a whole host of other health problems, and this is really going to depend on that individual. Now, if you look here, these are just some of the problems that we know are caused by chronic inflammation. One thing that you probably notice is that there are problems that really almost every person over the age of 40 starts to struggle with. These are problems that traditional medical system just has a very, very poor track record of helping. And that's because traditional medicine throws more medications at these problems rather than addressing the root cause and the lifestyle factors that go along with this disease in the first place. All right. So in closing today's video, I recommend this test for, number one, those individuals who have celiac disease, or maybe they even have non-celiac gluten sensitivity, and maybe they followed a strict gluten-free diet. Number two, those individuals who eliminated gluten on, let's say, a trial basis, but they still struggle with the symptoms. And finally, those individuals who have eliminated gluten, but their diet is now just filled with these cross-reactive foods, right? So there you go. Those are really the three main groups or categories of people that I feel understanding this background story of gluten cross-reactivity can be very helpful to, and really why I test for it, and really how it might be the missing piece of your health puzzle. If you can relate to what I just talked about in today's video, then I recommend the gluten cross-reactivity test and consult. I'm Dr. Hagmeyer. Take care.